very good evening, assalamu alaikum, and a very warm welcome to Visionary Pulse with me, your host Farzana Mayet, a segment which always focuses on chatting to game changers and change makers. And tonight is certainly no different, where we bring you one such game changer and change maker. We say a very good evening and a warm welcome, assalamu alaikum, to Professor Nasreen Mahomed. Professor Nasreen Mahomed is the academic head of radiology at the University of Witwatersrand, the largest training circuit in Africa with 72 radiology registrars. She holds 4 degrees and completed a pediatric radiology fellowship in neuroradiology at Boston's Children's Harvard University, USA. She has 78 peer-reviewed publications, supervised 17 MMEDs to completion. Her research is innovative, pioneering readers in artificial intelligence in pediatric radiology, one of the first authors to publish in pediatric radiology as well. She also has extensive experience in pediatric chest and pediatric neuroradiology. Professor Mahomed is one of the youngest faculty members to obtain a PhD and promoted to associate professor in the School of Clinical Medicine, Faculty of Health Sciences, University of Witwatersrand, and ranked amongst the top 75 medical schools internationally. Professor Mahomed is highly respected in her field and has been awarded national and international awards throughout her academic career, including the Carnegie Corporation USA Fellowship and Discovery Foundation Fellowship, the SAMRC Research Grant, the RSNA Derek Howard Nash International Fellowship, the Robert Austrian International Fellowship, Best Oral Presentation Wits Faculty of Health Scientists for Doctoral Research, the Gauteng Health Excellence Awards. The Department of Radiology, Wits University, was awarded the American Society of Neuroradiology, ASNR, and Osborne Visiting Professor under the leadership of Professor Mahomed, who also facilitated a national education in neuroradiology effort through the Radiology Society of South Africa. She's also the Vice Academic Chair of RSSA. She's also been a recipient of the Woman of Wonder Award as well. Professor Mahomed has been an invited speaker at many national and international congresses, and most recently the European Society of Pediatric Radiology 2025 and many others. We say a very good evening and a warm welcome to Professor Mahomed. Assalamu alaikum. Thank you so much for joining us on Visionary Pulse.
Wa alaikum salam, and jazakallah for the invitation.
Okay, so Professor Mahomed, wow, an extensive profile at that. I've got to ask, with regards to radiology, what is it that you specialize in?
Thank you very much. So my specialty is pediatric radiology as well as women's health. So
Okay.
I work at Rahima Musa Mother and Child's Hospital.
All right.
This is the only woman and child's hospital in the country.
Okay.
So we offer a very specialized field.
Okay, and so, women's health, you mentioned with Rahima Musa Hospital, pediatrics. Okay, we'll get to pediatrics at a later stage, but let's move on to women's health first. With the mammographies and things, can you elaborate a bit more on that? How imperative it is, let's start off right by the top. How imperative it is, and I think, you being a professor at that, in your fields of expertise, how important is breast care for women?
Thank you very much for the question. So breast cancer, according to the South African National Registry, the prevalence is 1 in 26 women in South Africa have a chance of having breast cancer.
Right.
So the mammogram is a radiology tool that allows the detection of early breast cancer.
It's up to the lady, you're right. It is up to an individual, obviously, to decide now to take their health into their hands and to decide to put themselves as a priority. I would think that that's most important. And I think you will agree with me on this, Professor Nasreen.
Yes. So the challenge is really for breast cancer in South African women is the late diagnosis. Often a major issue is that when a lady is diagnosed in stage 3 or stage 4, the chances of survival decreases. There's also limited access to screening services like mammograms, and there's also the stigma and fear of many women that discourage them from seeking advice or assistance early.
You've mentioned as well off air that there's a lot of women that are getting diagnosed when they're fairly young as well. So what are some of the things that mums can look out for if they're taking care of their breast care? What is it that they can look out for their kids as well, for the girls that, to educate the girls and to educate their daughters better on, you know, taking care of themselves and examining themselves fairly early?
So essentially we look at the risk factors. So every woman above the age of 40 should have a biannual mammogram. Family history. If there is a family history of breast or ovarian cancer, then essentially women should seek screening much earlier in life, from the age of 30, etc.
Okay, so the risk then increases, obviously.
Exactly. An example is Angelina Jolie. So she had a genetic history of breast cancer in her
With her mum had it, right?
Exactly.
Yeah.
And it was related to the BRCA gene. And she had a very invasive, she had a preventative bilateral mastectomy
yes.
and oophorectomies. And because of her very high risk of developing breast cancer due to the genetic mutation in her family line.
Okay, okay.
Other factors that are related to breast cancer include alcohol, the lack of physical activity, increased estrogen exposure, and that is related to hormone replacement therapy, as well as early menstruation and late menopause. So the increased risk or exposure to estrogen increases the risk of breast cancer.
Wow. Okay, and that's something that, and how would a lady then know that, you know what, she's got now an increased estrogen levels? How would you be able to ascertain that?
Essentially, is
there tests available for that?
Yes, you can do blood tests to look at levels of estrogen and progesterone, but really when women are diagnosed with breast cancer, then they test. So we now go on to precision medicine, where we specifically look at what the actual the phenotype of the tumor is, and we look at whether it responds or not to specific drugs. But it's been shown that these tumors essentially are sensitive to estrogen. So during the period of treatment, that's very imperative. Women should do a monthly self-examination. If they find a lump, they should go to a referral hospital or clinic or the general practitioner for further examination. Usually, if the woman has a lump under the age of 40, then it's benign. And but we would,
you need to obviously get tested first, not take it for granted that you know what, it is benign or it's a problem.
So in a woman under the age of 40, we would do a standard ultrasound to examine the breast further. Whereas in a woman from the age of 40 and above, we would do both an ultrasound and a mammogram to evaluate the breast further.
Okay, so those are some of the things that we need to look out for. Okay, and women's health, you know, aside from the breast care, what else can you elaborate on for the benefit of our viewers? Because I think women's health is so vast, Professor Nasreen. I think you will agree with me. There's a lot of, you know, things that women do tend to take for granted. So what are some of the things that you'd like to elaborate on, that you specialize in your field, which you'd like to educate our viewers on better?
Sure. So osteoporosis is a significant yet under-recognized health concern among South African women. It's shown that approximately 50% of women 81 years and above will have osteoporosis. And the risk of fractures of the spine as well as the hip increases approximately 15% with the degree of osteoporosis. So the key risk factors for osteoporosis is hormonal changes. Postmenopausal women have a decline in estrogen and hence have increased bone loss, increasing osteoporosis. Lifestyle factors including lack of physical activity as well as decreased calcium and vitamin D intake. Essentially, you want to have bone strengthening exercises and nutritional deficiencies. You want to fortify your foods with high calcium and vitamin D. Other risk factors would include smoking, alcohol consumption, certain medications that increase bone loss.
Okay, so those are some of the things that, women can look at. Thank you so much for elaborating on that. I think it's really great for our viewers to be able to jot down some of the factors that may cause it. And, we'll get back into the, the nitty-gritties of it more and go more in depth with regard to osteoporosis when we come back after the break. Welcome back. After the break, you are tuned into Visionary Pulse with me, your host Farzana Mayet, in conversation with the inspiring Professor Nasreen Mahomed. So, Professor, we were talking about, before we went into the break, osteoporosis. I promised our viewers we're going to be going a bit more in depth as well. So, care to share a bit more about bone density scans, things like that, just for the benefit of our viewers out there?
Sure. So a bone density scan is typically performed in a woman 65 years and older.
All right.
And it gives essentially a graph on what the density of the bone is. Specifically, it looks at the hip and the vertebral bodies in comparison to an associated population group. So it will say whether you are at a normal bone density or a bone density osteoporosis and increased risk for fractures. And typically,
so this would be able to, the bone density would now be able to inform you fairly early of what's going on.
Absolutely.
Okay,
absolutely.
Brilliant.
And then it would inform you on the treatment or the way forward in terms of a specific treatment that you would be put on to decrease bone breakdown. Example, biphosphonates, increasing your calcium, vitamin D intake, and also your exercise by, your aerobic exercises to increase your bone density, which I think is essential. And this is, I think osteoporosis is often a very underlooked condition in our society.
I would think so. But why is it such, Professor Nasreen? I think you'd be able to shed more light on that. Why is it that it's often overlooked?
I think we live in South Africa and we have a good exposure to vitamin D by the sun, but often cultural, the way we dress, we don't have increased exposure to the sun. That would be one of the
factors. And that's one of the prioritizing factors, right?
Exactly.
Okay.
The other is, they talk of organic foods that we eat. So often our foods are not fortified enough with the extra supplements that we as women would need.
Okay, so it makes it a bit difficult.
Absolutely. Saying that, we in the Southern Hemisphere, there has been studies to show that we are at decreased risk of osteoporosis having the sun exposure compared to countries like Europe, etc., where the sun exposure is less.
Much more less, okay.
Yes.
What are other factors, Professor? Is that it?
We said smoking, alcohol intake, definitely.
And those are some things that many people would take for granted, right?
Absolutely.
That it would be one of the main key factors regarding osteoporosis.
Absolutely.
Wow.
And then exercise. I think we often forget the importance of exercise in a daily routine. Discovery has introduced the multiple innovative plans to look at health, and it's called the steps. But they say just walking 1,000 steps a day increases your health. And certainly osteoporosis is one of these things that exercise can have a positive impact.
Wow, that is amazing. Okay, so Professor Nasreen, thank you so much for touching on, osteoporosis, the causes, some of the key factors that are so often overlooked. I think, as Visionary Pulse is always for the benefit of our viewers, this information has really, really, really given priority to to being beneficial to our viewers as such. So let's touch on mental health now. Some of the most important prerogative measures that needs to be undertaken, because the topic for today is mental health. Let's talk about and women's health care. So let's talk about mental health in women.
Thank you. So depression is twice as likely to occur in women than it's to occur in men. And some of the factors related to that is hormonal changes, pregnancy, and menopause. So essentially, postpartum depression occurs in 20% of women, and often it's under-recognized. And one of the reasons is the stigma in society of mental health, that women often who have specific issues are afraid to actually seek help due to the social stigmatization.
So, Professor, a lot of, we've touched on osteoporosis, we've touched on, the key factors that does cause osteoporosis. Thank you so much for elaborating on the key factors which may have been overlooked by our viewers out there. And, that's what Visionary Pulse is all about, to educate and enlighten our viewers out there. So, as we are focusing on women's health and, the segment thereof, mental health, how important is mental health for women out there?
Mental health is imperative.
Right.
Mental health disorders are twice as likely to affect women than men, and these include depression, anxiety disorders, postpartum depression. Recent statistics show that approximately 20% of mothers can have postpartum depression, post-traumatic stress disorder, especially related to violence against women. And then eating disorders and self-harm disorders are some of the mental health issues that we as women are faced with.
So you mentioned when you just started that women tend to suffer, from mental health issues more than men. What were the statistics around that, and why is it such? Why would you say so?
So essentially, I think it's a spectrum that women, firstly, have hormonal changes. And when estrogen decreases as you enter a phase like postmenopausal symptom, then you do have increased risk for depression. Okay. Then postpartum, your hormone levels change, and hence you are increased risk for depression. So that is really related to hormone levels. But then if you look at elements within society, women are often multitasks,
right.
So they are essentially running a home, running a family, as well as running a professional career. And
so it all intertwines together.
Absolutely.
Yes, there's a lot of pressure.
Increased pressure on them can predispose to mental health issues.
Okay, so more on that when we come back after the break. Welcome back after the break. You are tuned into Visionary Pulse with me, your host Farzana Mayet, in conversation with the inspiring Professor Nasreen Mahomed. So, Professor, we were talking about mental health and the importance thereof. You were going to elaborate post that when we broke in for an interval. So please tell me, what else can women look out for? What are some of the measures they need to take? I think that's most imperatively important.
Sure. So other risk factors also include gender-based violence,
Okay.
economic hardship, and overwhelming caregiving burdens, and then social inequality and discrimination in society. So essentially, women need to actually identify risk factors. By identifying risk factors early, they can then seek a treatment much earlier.
Okay.
And risk factors can be small, changes in mood, low energy, low appetite, insomnia, difficulty falling asleep, difficulty staying asleep, or actually sleeping and not feeling refreshed, having excessive worry or thoughts in them, that they
so
can't
it's basically
control.
the changes from your day-to-day living.
Absolutely.
It takes a turn.
Absolutely.
So then you can say, okay, fine, I've got a problem.
Yes.
This is where now you pick up that, okay, there is a bit of a problem now before it, and would you say, Professor, while we're still on this topic, does it tend to get worse if not treated?
Essentially, the key factors is you identified that there is a problem. How do you then treat it?
Yes.
So having social support is one of the key elements to mental health, and then going out and seeking therapy in terms of medical therapy as a psychologist, general practitioner, or going higher to a psychiatrist really will be determined by the level of mental health and the level that it impacts your daily living.
Okay.
No,
I think that's most important. But Professor, you spoke about, the social standing and, the social support that every person would need. What happens if a person is too scared to speak out?
So
what would your advice be in that certain scenario? Because like we spoke about fairly early in the program, we spoke about stigmatization, where people are so scared to come out and say, look, I've got a problem. I'm really suffering. I'm anxious. It's more like we spoke about now, that, you're feeling not yourself.
Absolutely.
There's changes in the patterns and you'd like to get assistance fairly early, but how? How, when there is obviously that stigma? How do we, the social support you said is one of the key factors, but how, just for the benefit of our viewers out there, so they can say, okay, fine, I've got this problem. Professor Nasreen has advised, and this is what we're going to do now going forward.
I think you brought up a very important message to our viewers, is that social stigmatization of mental health is there.
Yes.
But one of the, the key elements that came out post-COVID pandemic is that mental health actually is one of our, leading causes of morbidity and mortality within a society. And it's often due to stigmatization, it's often overlooked, and where it should be actually one of the forefront of any society. Women, they would often, I think the women, because they, multitasking and they're running households, etc., they would often hide these symptoms from their family.
It would be masked, obviously, because I'm busy. I'm a busy person, for example. I run different businesses, and it would be masked that, I'm keeping busy all the time. So you try to put that at the back of your mind.
Absolutely.
I understand where you're coming from, because you're saying that obviously somebody's trying to keep busy, and then they're masking that, what's that underlying cause, and having it not being treated because I'm very busy to seek assistance or things like that.
Absolutely. And then what happens is we then read news reports where a very successful woman, example, the previous Miss USA, a very high functioning woman at the age of, I think, 28, committed suicide, and she accomplished so much in her life, and everybody that worked around her just wasn't aware that she was ill. So I think, early, the earlier the intervention, the better the outcome, as in any condition in health. So I think mental health should never be viewed in isolation. It's it's imperative to our well-being.
And I think it's so important that, this topic is being brought about more and more often, because the more we talk about it, the more it's going to be, educating for the people that are now have this misconceptions surrounding mental health. It's only going to bring about positive changes in the person that, should you be telling me, for example, you have a problem, and should I in the past have had my reservations about mental health, I would be more educated and more, wanting to be receiving of whatever problems you're going through, you can talk to me about it. So education, I think, is key, and thank you so much for highlighting that.
Education, and I think social empowerment.
Yes.
The earlier you take treatment for mental health issues, it doesn't have to be necessarily medication. It can be, interventions through psychotherapy or speaking to a psychologist, social support, etc. The better the outcomes.
Okay.
And with any condition, the later you take intervention, the worse the outcomes.
Oh, and it's wonderful that you're saying it. Now, I'd like to reiterate that as well for the benefit of our viewers, that the later you then seek intervention, the worse it then becomes, and the longer the healing process. Am I correct?
Absolutely, absolutely.
Okay, so Professor, we are going to, the different types of depression before we touch on a topic that's been on everybody's lips recently. Okay, so, postnatal depression, especially when moms have given birth to their babies, and all of a sudden this change happens whereby they don't know what's going on in their minds. A change happens, like you've mentioned, lack of sleep, they're having negative thoughts all the time, and this person has always been positive. What then?
So, I think it's very important. Current studies show that 20% of women can actually suffer from postpartum depression. And essentially, it's not only the welfare of the mom, it's the welfare of her children, her newborn baby, as well as if she had other children. So it's imperative to identify, that's number one, identify that it is postpartum depression, and then seek assistance.
Okay, that's perfect. And then something that's been on everybody's lips right now, Ozempic. Can you please elaborate a bit about Ozempic and everything that's pertaining to Ozempic? Let's start from the top.
Okay. So Ozempic, it's characterized as the wonder weight loss drug, and it's all over the media, and I think it's coming across as, could this be our new, magical solution? So a bit about Ozempic. It's a GLP receptor agonist. So that means it works like your natural GLP in the body. And this hormone regulates your blood sugar in your body, and it regulates your appetite. So essentially, by lowering your blood sugar, it increases insulin secretion, and when blood sugar is high, it decreases stomach emptying. So your gastric emptying and decreases, so you feel more full.
You feel fuller for longer.
Absolutely. Okay. And then it also acts directly on the brain by affecting the receptors in the brain that affect hunger and cravings. Okay. So it's actually quite multimodal.
Okay, I'm going to go on the question that I think is on everybody's lips. Is it safe?
Okay, so, Ozempic certainly has indications. Usually there's a lot of, I think there's a lot of media surrounding Ozempic, and I think it has side effects. And we need to be aware that side effects include nausea, vomiting, diarrhea, constipation, appetite loss. Other side effects include pancreatitis, gallbladder issues, thyroid issues as well. But the major side effect that we're currently seeing is that people that lose weight from Ozempic, 50% of that weight loss is due to loss of muscle mass and bone density, rather than 100% fat loss. So our muscle mass, if you look at all studies, it's an indicator of longevity, of a well-being. And now we are saying that taking Ozempic actually decreases your weight loss, but 50% is due to weight, muscle mass, and bone density. So that is something that really has come into the forefront of taking Ozempic. I'm sure you've seen, newspaper and articles on the Ozempic face or the muscle wasting.
Yes.
And that is one of the reasons. And, they say the cause is it decreases your appetite, but it also, with decreased appetite, it decreases your intake of protein, right?
Okay.
And by decreasing protein, you increase muscle loss.
All right. So, Professor, I want to thank you so much for joining us on Visionary Pulse. It has been a pleasure having you here. Before we sign off, any motivational quote that gets you up every morning? You know, you've got such a vast portfolio and you're such an inspiration to so many. What is one motivational quote that you ascribe to?
The role of a woman in society is often very difficult because we often multitask.
Yes.
But it's so important that we, prioritize our health. And I hope I touched on important points, breast cancer, osteoporosis, mental health, and weight loss drugs like Ozempic today.
Okay. Thank you so much, Professor Nasreen. It has been an honor and privilege having you in studio. So that brings us to the end of another wonderful segment of Visionary Pulse. Join me, Farzana Mayet, next week as I bring you another game changer and change maker. Assalamu alaikum and a very good evening to you.